My name's Alicia, and this is my health assessment number 2. Today, Jake is going to be helping me with my assessment. First, we're going to start off by discussing what we're going to be all looking at. We're going to look at the heart, assess the heart, the lungs, the mouth, the nose, the eyes, and the ears. We're also going to be talking about the cranial nerves during this assessment. And first off, I want to discuss the Snelling chart. It's used to determine how well visually a person can see distance-wise. You want the patient to stand back 20 feet from the chart and then read the smallest line possible that they can read and get all the letters correct. And that will determine how good their vision is. You want them to do it with both eyes, one covered at a time, other one covered, and then both of them without. If your patient has corrective lenses or glasses, have them do it without it first, and then go ahead and put their glasses on or their contacts in and do it with their contacts to see if their contacts and glasses are to where they need to be so that they can see 20/20. Another visual exam that we do is the Rosenbauer. It's a smaller sheet, and you have them hold it about 14 inches from their face, and then you have them go ahead and read the letters. It's for testing near vision. And let's go ahead and actually start moving into assessing the eyes. So first off, we're going to start with the 6 positions of the cardinal gaze. So I'm going to show you my finger. If you can just follow me with your eyes, but keeping your head straight. And that all appears normal. With this, we're checking cranial nerve number 3, which is the ocular motor cranial nerve. So next, we're going to check the corneal light reflex, the twinkle that we see in our eyes, and this is assessing cranial nerve number 4, the trochlear cranial nerve. My pen light out here instead. And he does have both the twinkles in his eyes. Next, we're going to move to the cover and uncover test. What we're looking for in this test is whether the eye muscles, whether they lag or not during the test when you uncover an eye, if the eye just kind of fades to one side or the other. So just look straight forward for me. Okay, no movement there. And no movement there. So, and that is cranial nerve number 6, and that's the abductus cranial nerve. We're going to go ahead and start inspecting his eyebrows. We're looking at the color, the shape, the symmetry of the eyebrows. You want to look at the eyelashes, the distribution of the hairs. And you want to know the lid, if it's drooping or sagging, or if there's any kind of lesions or moles or anything that look irregular. You're going to go ahead and inspect the lids, the cornea, the anterior chamber, and the lacrimal duct. So I'm just going to go ahead and look at that here. So I'm looking at his cornea. Kind of dark in here, so I'm looking at his lids. I'm going to palpate his lacrimal ducts. They both have good rebound to them. And I'm going to inspect his conjunctiva, his sclera, the position of the globe, and his irises. Okay, I'm also going to go ahead and look at his pupils and make sure they're equal, round, reactive to light. You're going to want to look direct and consensual. So. Okay. Next, we're going to go ahead and actually look at the red reflex of the lens and the lens clarity. When assessing his eyes, I noticed that he has some yellow coloration in his sclera, but other than that, everything appears to be normal. Next, we want to look actually at his optic disc and the retinal veins in the back of the eyes, and for any AV, different possible colors, hemorrhage, exudate. So we're going to go ahead and look at that. Okay, good red reflex. Okay. So you want to inspect the eyes very thoroughly when you're doing your assessment on the patient. Now we're going to go ahead and move into the ears. So you want to first assess the outside of the ears. You're looking at the symmetry of them. The external meatus. Sorry. They both appear equal and normal. You're going to inspect the mastoid, the medius ear canal, and then when you're looking in the ear canal, you're going to look at the tympanic membrane, looking for the cone of light. When you're in there looking, you want to look for any color, discoloration, red, any buildup of earwax. I'm going to look in your ears now. Okay, he has a nice grayish tint to it with the light reflex. And this one also looks gray with my light reflex. I do note some redness in this ear. Is this ear giving you problems? No? Okay. So now that we looked in the ears, when I was also in there, I was looking at the malleus and the paratensa and the umbo. I'm going to go ahead and do a whisper test with the patient. Let me know if you can hear what I'm saying.
Yes. Yes.
Okay. You would want to assess with a tuning fork the Weber and the Rhine test. I don't have a tuning fork to do this, but the tuning fork would sit in the middle of the forehead. You would percuss on that tuning fork, and then they would tell you how long the vibration lasts for. For the other part of the test, not the Weber test, but the Rhine test, you place the tuning fork on the mastoid, and you do the same thing. So let's move into the nose. All the past stuff of the ears, we're assessing cranial nerve number 3, which is the acoustic cranial nerve. So I'm going to have you go ahead and close your eyes for me. I'm going to have him smell something here. I'm testing cranial nerve number 1, which is the olfactory cranial nerve. Just take a little sniff.
Smells good.
What does it smell like?
Cinnamon? And
it is cinnamon. So when looking at the nose, we want to look at the size, the shape, the symmetry, the septum, and note if it's deviated or not. You're looking at the mucosa. What color is it? Is there a lot of drainage? You're looking at the turbinates. You want to make sure that you're going to determine the patency of the nose. I'm going to go ahead and look up your nose, okay? I don't see any drainage. Septum is intact. Can you blow just out of your nose? And he is patent on both sides of his nose. We determined that he could smell the cinnamon. So we're going to move forward into the mouth and the pharynx. So we're going to go ahead and assess the lips, the mucosa, the teeth, the gums, and the sublingual area. So if you can go ahead and open your mouth for me. Can you stick out your tongue forward, side to side? Can you say ah? Ah. So when you have them say ah, you are actually assessing the cranial nerve number 12 with the hypoglossal when you move the tongue back and forth and up and down. And when you have them speak and swallow, you're assessing cranial nerve number 10, which is the vagus nerve. And the glossopharyngeal is cranial nerve number 9, and that's when you have them say ah. So when looking at the tongue, you want to look for any masses, any discoloration, any kind of lesions on the tongue. A lot of times you want to assess all the way back on the tongue. A lot of people forget to assess way back there. It's a common spot for oral cancer to start. You want to inspect the uvula. You want to look at the hard palate. If you go ahead and open your mouth. Okay. And all of his teeth appear intact. And he's got good mucosa, pink and moist. And his tongue appears pink and moist as well. So let's go ahead and move into listening to the lungs. So first I'm going to start off by just inspecting the patient. I'm going to look at his chest for any, on the anterior side and the posterior side. I'm sorry, my hands are really cold. I'm going to look at the shape. I want to look at the color. Is he pink or white in color? Is he blue in color? I want to see if he has a bulging chest or if he has just a nice, rounded, normal chest. I want to look at his movement when he breathes in and out. And I want to look at the symmetry from side to side if there's any variation in it. So once I have looked at that, I'm sorry, my hands are really cold. Then I'm going to go ahead and I'm going to look at his expansion. Can you take a big deep breath in for me? Okay, I'm looking for equal rise and fall of the chest. I'm going to go ahead and palpate next after I inspect. I'm just going to go ahead. I'm feeling for any bulges, masses. Okay, and was there any tenderness with that?
No.
No? Okay, so I'm going to go ahead and have you say 99.
99.
99.
99. 99. 99.
Okay, and I'm feeling for the tactile fermentus there. I'm going to go ahead and percuss the posterior chest. I'm going to have you turn around, actually, so we can see better. So my back isn't, just sit to the side of. So I'm assessing if there's any dullness or any fullness that I would feel that normally you wouldn't feel there. After I'm going to do that, I'm going to auscultate the posterior and then the anterior lung fields. Big breath in. And exhale. In. And exhale. In. In. Out. I'm going apex to apex, base to base. I'm going to do it anterior side now. In. Okay. And he has nice expansion, full lung expansion on inhale and full exhale as well. So now that we covered all of the lungs, we are going to move into the heart, assessing the heart. First, you want to look at the anterior chest. You're looking for any heaves, lifts, or thrusts in that chest. Go ahead, can you face the computer for me? So I don't see any heaves, lifts, or thrusts in the area of the cardiac chest. I'm going to go ahead and I'm going to palpate the anterior chest for PMI. I'm assessing for any murmurs. No murmurs noted. I'm going to go ahead and now I'm going to listen. I'm going to start off by listening, auscultating on the aortic area. And you're listening to S2 there is what you're wanting to hear. From there, you're going to move on to the pulmonary area. And that's also S2 that you want to hear over S1. So the next point that you want to auscultate is Erb's point. Okay, and I hear S1 there. So we're going to move into the tricuspid area. And then from the tricuspid, we're going to move into the apical area, which is also the PMI area when assessing. So that's the tricuspid area that we're listening to right there. And that's S1 as well. And now we're in the apical, the PMI area, and we're assessing S1 is heard over S2. Okay, everything sounds normal with your heart. So we're going to go ahead and we're going to palpate some of the vascular areas on the body. I'm going to palpate the carotid artery. Okay. Bilateral. Go ahead and assess the brachial artery. Okay, we're going to move down and we're going to assess the radial arteries. Next, we're going to move into the popliteal artery.
Scoot back a little.
I'll just move it down. You're going to want to assess the dorus pedialis artery, which is located on the top of the foot, bilateral. Strong pulses, bilateral. And then you're going to want to assess the posterior tibialis, which is on the back side of the ankles. And that is strong and good bilateral. This is the completion of my health assessment number 2. Thank you.